Greetings everyone. I am delighted to welcome you to this video lecture series. My name is Dr. Megha Singh, MPT Cardio Assistant Professor at Rabindranath Tagore University. I am here to make learning pneumothorax, often referred to as a collapsed lung, enjoyable and accessible. Let's dive in and explore together on this engaging educational voyage. Now let's define what is pneumothorax. Pneumothorax is defined as the collection of air outside the lung but within the pleural cavity. Also, it can be defined as when air leaks into the space between your lung and chest wall, causing the lung to collapse partially or completely. This air accumulation can result from various factors such as trauma, lung diseases, or even spontaneously without any apparent cause. Now, what are the types of pneumothorax? There are several types of pneumothorax, each with its own set of causes and characteristics. First one is spontaneous pneumothorax. This type occurs without any apparent cause, often in individuals without pre-existing lung conditions. There are two subtypes of spontaneous pneumothorax. First one is primary, in which people without lung diseases. Secondary, and individuals with lung diseases. Now, the other type of pneumothorax is traumatic pneumothorax. As the name suggests, this type results from some form of trauma such as car accident, fall or penetrating injury that causes a rupture in the lung or chest wall. Now, the last type is tension pneumothorax. A medical emergency tension pneumothorax involves increasing pressure in the chest cavity due to the continuous influx of the air. This can rapidly compromise cardiovascular and respiratory function and requires immediate attention. Now, let's discuss the causes of the pneumothorax. First, spontaneous cause. The primary spontaneous pneumothorax typically occurs in healthy individuals without any underlying lung disease. However, there are some risk factors such as smoking, pregnancy, familial pneumothorax. Secondary spontaneous pneumothorax linked to pre-existing lung conditions such as COPD, chronic obstructive pulmonary disease, TB, severe ARDS, cystic fibrosis, inhalation of drugs such as cocaine, marijuana, etc. Now, the other one is traumatic cause. First is blunt trauma, injuries from falls, car accidents or direct blown to chest can lead to pneumothorax. Second is trauma, gunshot wounds, stab wound may puncture the lung, causing air to escape in the pleural space. Now, the other moving forward, clinical presentation. Recognizing the signs and symptoms of pneumothorax is crucial for timely intervention. Common indicators include asymptomatic to chest pain, shortness of breath, increase in central venous pressure can result in distended veins and hypotension and even death, rapid heart rate, and on physical examination we may find the following findings such as sudden sharp or stabbing chest pain which radiates to ipsilateral shoulder, asymmetrical lung expansion, decreased tactile vocal fremitus, hyperresonant percussion note, decreased intensity of breath sounds or even the breath sounds may be absent, cyanosis in severe cases. Moving forward, now let's discuss the diagnosis of the pneumothorax. Diagnosing pneumothorax involves a combination of clinical evaluation and imaging studies. Chest X-rays are often the first line of investigation, revealing the extent of lung collapse and presence of air in the pleural space. 2.5 cm air space are equivalent to 30% of pneumothorax. Next is CT or computed tomography. Scans may provide more detailed information in certain cases. Now, let's discuss the treatment of this. The approach to treating pneumothorax depends on its severity and underlying causes. First one, on observation, small and asymptomatic pneumothoraxes may require only observations. Close monitoring and follow-up imaging are essential to ensure resolution without complication. Other one is oxygen therapy. Administering high flow oxygen helps facilitate the reabsorption of trapped air and may be sufficient for small pneumothoraxes. Third is needle aspiration. For moderate size pneumothoraxes, a healthcare professional may use a needle to aspirate and remove excess air from the pleural space. Next is chest tube insertion. Larger or persistent pneumothoraxes often necessitate the insertion of a chest tube. This allows continuous drainage of air until the lung re-expansion and the underlying cause is addressed. Last one is surgery. In some cases, the surgery intervention may be required to repair lung ruptures or address underlying lung conditions contributing to recurrent pneumothoraxes. Now, let's discuss what are the prevention of the pneumothoraxes. While not only cases of pneumothorax are preventable, certain measures can minimize the risk, such as avoiding smoking to reduce the likelihood of primary spontaneous pneumothorax, using protective gear during activities with high risk of trauma, managing underlying lung conditions through proper medical care. Now, I would like to conclude my video. In conclusion, pneumothorax is a condition that demands understanding and attention. Whether spontaneous or traumatic, recognizing the signs and symptoms is crucial for prompt diagnosis and appropriate interventions. As healthcare professionals or individuals interested in respiratory health, it is our collective responsibility to stay informed about the pneumothorax and contribute to its effective management. Thank you.